Yes, dear Michael, thank you very much for your words. Ladies and gentlemen, as a member of the medical profession, I solemnly pledged the health and well-being of my patient will be my first consideration. That means if I have to recommend a nutrient for well-being, I have to be sure that there are no side effects. And this is my topic today when we are talking about alpha-linolenic acid. 30 to 40 years ago, we thought that alpha-linolenic acid is only a precursor for the production of EPA and DHA. But more sophisticated methods showed us that the conversion rate from ALA to EPA may be only 0.2%. So the presence of this fatty acid in plasma is much longer. And this was the case that why we had to deal with the physical and medical situation with this fatty acid. But before I come to specific problems of alpha-linolenic acid, I want to focus on 2 points. Where is fat modification in our lifestyle therapy of lipoprotein disorders? And as you can see, step 1 is to exclude certain disorders with a high influx of free fatty acids to the liver. And so we have to exclude anxiety disorders, postprandial hypoglycemia, extreme physical activity, and sleep apnea. If you cannot exclude these disorders, you have no chance to treat sufficiently a lipoprotein disorder by lifestyle therapy. So the second step is define energy intake. That means control body weight. And then you have to avoid alcohol and eat 5 meals a day. Step 3 is to reduce carbohydrates to 40% of daily energy. That means that you have to increase the intake of fat. It is beneficial. And then step 4 is modify fat quality. That means if you do not treat patients with step 1 to step 3, you have only a minor chance to improve the situation by modifying fat quality. And after modifying fat quality, you can consider other measures like an increase in the intake of fiber or the use of sphingomyelin to decrease the activity of hepatic lipase. And the second point is that fatty acids do not work in the same way in each individual. And this I want to show you on the example of saturated fatty acids. You all know the new publications saying that saturated fatty acids have no association with coronary heart disease. But I think it was not possible to show this because saturated fatty acids have different effects in different individuals. Here you can see a well-known slide regarding the effects of saturated fatty acids, monounsaturated fatty acids, and polyunsaturated fatty acids when replacing 1% of daily energy of carbohydrates on lipoproteins. And here you can see the well-known increase of LDL cholesterol by the addition of saturated fatty acids to the diet. But when you look to the right side, then you can see that saturated fatty acids decrease triglycerides to the same extent as monounsaturated or polyunsaturated fatty acids. So if you have an individuum with a lipoprotein disorder regarding triglyceride-rich lipoproteins, you can have positive effects on the risk of these patients by adding saturated fatty acids to the diet instead of carbohydrates. And this I want to show you with an own small study. Here we had 36 patients where we increased the intake of saturated fatty acids from 10% of daily energy to 17%. And we decreased carbohydrates to 40%. And here, the first topic are small dense LDL. You know, this is a very atherogenic lipoprotein particle. And as you can see, it was substantially decreased by the addition of saturated fatty acids to the diet. It also beneficial effects on triglycerides, total cholesterol, and LDL cholesterol, but no adverse effects on HDL cholesterol and lipoprotein a. And when we look to the triglyceride-rich lipoprotein VLDL, then you can see the clear effect of saturated fatty acids replacing carbohydrates. And this is very important because we could decrease the ratio between VLDL triglycerides to VLDL apolipoprotein B100 from 6.5 to 5.6. And this indicates that we were able, by the addition of saturated fatty acids, to eliminate remnants of triglyceride-rich lipoproteins in this fraction. And there was no adverse effect on LDL ApoB100 and ApoB100 in serum. So I think it's necessary to look for effects of dietary fat in different situations. And if you have the imagination that more than 75% of German people older than 30 years of age have a disorder of lipoproteins with a high triglyceride content. Now I'm coming to coronary atherosclerosis. And here you can see the opened coronary artery of a patient with a high degree of atherosclerosis. And here you can see fatty streaks, but also complicated lesions. I think you are not happy to see this picture. Now regarding omega-3 fatty acids. The story started with alpha-linolenic acid in the last century of the last, the last decade of the last century.